My name is Abraham Peled. I'm a psychiatrist, and for many years I'm trying to promote reconceptualization of mental disorders as brain disorders. Now, in the previous videos we talked about a range of psychiatric phenomenology based on the brain, and we also talked about personality and how personality is actually a set of internal representations embodied in the brain by our experience, a lifelong experience from childhood to adulthood, and the experiences are embedded in the brain based on Hebbian dynamics. Donald Hebb said that neurons act together, wire together, so the experiences activate neurons, and these neurons wire together to represent an internal map, let's say, of our experiences, and these are the maps that guide the way we interact with others. So, based on that, now when we go to talk about personality disorders, then we have to think in terms of network development and internal representations which cause biased, non-adaptable, rigid, and symptom-generating activity or behavior. And let's just give an example. Let's say that someone is growing up in a very unstable environment, like a ruined family, parents are divorced, being adopted, being moved from one place to another, doesn't have a constant home, loving parents. These kind of environments are unstable, and a brain trying to organize within this kind of input of environment will be equally unstable, because if we know that Hebbian algorithm means that repeated experience generate repeated connectivity and basic stable connectivity, then we have a chaotic environment, unstable and not consistent, will not allow the repeated activations to generate stable connectivity patterns. So actually the brain is organizing based on the experience. This is why the term experience-dependent plasticity is so important. The plasticity is the connectivity changes and stability of brain development, and the experience is the input within which this brain is trying to evolve and generate more complex and stable and adaptable constructs. So the way to diagnose, as we know, the way to diagnose personality disorder is to take the history of the patient. And if you get a history of someone who didn't have a family, who was abandoned, who was abused, who had to live inconsistent life, then we can expect that the brain organization would be disturbed in this sense of disturbed internal representation, internal optimal, adaptable representations, and that would cause misbehaving or behaving non-adaptively or not succeeding in life and not optimally resourcing your abilities, and that would lead, of course, to failure and to frustration and to conflicts, and that would lead, of course, to a mood which is a depressed mood or anxious mood and so on. Because we know that in the clinic, the people with personality disorder, their complaints when they come to the psychiatry about depression and anxiety, but behind it you will find non-adaptable failures and so on, all of these created because of unstable, biased way to interact in psychosocial events and life events. So we would now expect to find that personality disorders relate to some kind of biases and some kind of disturbance to the internal representations when they are embedded in a global brain network, which would be typically, as we talked in previous videos, it would probably be the default mode network, because the default mode network is a network at rest which generates patterns of connectivity which probably embed the internal representations that we are talking about. and if these internal representations are optimal and adaptable, then we have good behavior and successful psychosocial optimization, while if they are disturbed, then we will probably get the basis for the brain disturbance of personality disorders. Okay, next time we will talk also about how to cure personality disorders, what is the network approach to treat these patients. Meantime, you can register to my channel, Neuroanalysis, and you can go to my website, brainprofiler.online.